Hi, I'm Dr. Jonathan Abenheim. I'm the inventor of the Xcell implant process, and this video is to help you guys choose the right doctor for your implant procedure. Here's a couple questions I would love for you guys to ask when you show up to the consultation with your doctor. First thing is what's their expertise? Are they board certified? Are they specialists? Do they do this all the time? What is it that they do to do implant dentistry at the highest level? Here at Jonathan Dental Spa, I'm double board certified when it comes to implant dentistry. I have multiple patents in implant parts, and we've done a tremendous amount of implants in the past 15 years that I've been practicing. The other question you should ask is, how many implants do they place a year? Do they do one a week? Do they do one a month? How many do they do? In our practice, we do over 1,500 implant procedures per year. We do everything in-house. Everything is fabricated here with me and by me, so there's no outside lab, no questions, no delays or anything like that. How many doctors are going to be treating you? Do they have an oral surgeon, a periodontist, a prosthodontist, a general dentist, a lab technician, a dental assistant? Do they have this whole massive amount of teams that you don't know who's going to be treating you, or is it one doctor that's able to do it all? Here in my practice, we do it all. Basically, I'll do the surgery, I'll do the restorative part, fully digital, and I sit there and I create your teeth with a paintbrush, a custom special for you. Some doctors also will only do one part of your mouth at a time, which will need you to have to do 2 surgeries. So ask them, do they happen both at the same time, or do I have to come back twice? In my practice, we always do it at the same time, 1 surgery, 1 time. The other question is how long is the procedure? You know, the longer the procedure is, the more pain, the more swelling, the more risk of infection that you're gonna have. In my practice, the procedures take, no matter if it's the upper or the lower or both, no longer than 2 to 4 hours. So that also takes into effect the fact that, hey, are you having sedation for this? If you're having sedation for this, you understand that the longer the sedation goes, the more likely you are to have a complication, and obviously the more money it's going to cost. So in my practice, again, 2 to 4 hours is the maximum amount of time it takes for the surgery and the teeth on the same day. The other thing is, it's very common that we hear patients are told, I'm not a candidate. I was told I'm not a candidate. What does that do for the patient? It sort of really makes them sad, really makes them that they have no hope. If you're able to get into the car, drive here, you're a candidate. We have multiple different abilities and techniques to be able to give implants to anyone. How many implants do you expect to have? You know, there's a big trend in dentistry that says this all on 4. And we have this saying, it's either all on 4 or all on none. In my practice, we over-engineer every single part of your case. So we place as many implants as we can. We don't charge you more or less for it. If your body has the ability to receive more implants, we'll place more implants, so you always have security for the future. So it's very important to ask that. Are there any extra fees? Do they charge you for post-op appointments? Do they charge you for temporary teeth? If something happens to the temporary teeth, do they charge you again? Do they charge you for a night guard? What are all these extra charges at the end? It's super important to ask. The other question is, you know, people say to me, well, you know, I looked in the newspaper and it's so much cheaper everywhere else. How is that possible? So, you know, you have to ask questions. You know, where are the implants being made? Are they made in China? Are they made in America? Are they made in Switzerland? Where are they being made? Implants cost a lot of different prices based on, you know, their success rate and their research behind them. So make sure you ask, what type of implants are you placing? Secondly, what are the teeth made out of? You know, in order to cut costs, a lot of dentists, what they do is they'll make you a teeth out of plastic. They'll make you dentures that are just bolted into your implants. Yeah, they may look good in the beginning, but how long does it last? Does it stain? In our practice, our go-to material is zirconia. The beautiful thing about zirconia is it's really, really strong. It doesn't change colors, and it looks spectacular from day 1 till the end. So that's really a spectacular part. What about the pain? What's the pain that I should be worried about after? Because our procedures are so fast in our practice, the amount of pain is very minimal. Obviously, if you have infections that are present, you may have a little bit more pain. But because we do our surgeries so fast in 2 to 4 hours, that's why you have very minimal pain. The other question is am I going to be using all of these gooks, these molds that go in my mouth that make me gag? So in our practice, based on my patented process and my invention, everything is done digitally. So it's very important that you ask that to your provider. The other thing is the lab in-house. So in our practice, the lab is me. We do everything, we create everything here, we cut everything here, everything is done right here. And then the most important question is, will I ever have to walk around without teeth? One of the promises that we have to our patients is that you will always walk out with teeth. You'll never have to walk out without teeth. If it's your choice not to wear teeth, that's your choice, but we will always find a way to give you teeth, and you'll never have to take them out and put them in a cup at night. So until then, make sure you ask the right questions, choose the right provider, because implant dentistry must be done correctly the first time. You don't want to have to redo it a second time. Have an amazing day.